Heroin addiction and overdose deaths are a concern across the country, including here in New Mexico. There was an increase in overdose deaths last year, and there is a drug that can help reverse overdoses in many cases and save lives, but the State Department of Health is currently reviewing policies on the distribution of that drug. Our correspondent Stan Wilson sat down with two experts to talk about what is being done to address heroin addiction and bring together groups that are working on different aspects of this issue across the state. This is part 2 in our series on heroin addiction.
We're joined today by Dr. Paul Roth, Chancellor of the University of New Mexico Health Sciences Center, and Damon Martinez, the United States Attorney for New Mexico. Welcome, gentlemen. Let me start off with you, Damon. What's the federal role right now in terms of addressing the heroin addiction across communities?
Well, the U.S. Attorney's Office takes a strategic approach. We have proactive and reactive cases here in New Mexico. What we're trying to do is we're trying to go after the drug trafficking organizations. So one, we try to look at the arteries going through New Mexico, the highways, the trains, the buses, and make sure that we catch drugs going through those areas. Those are our reactive cases. Then also we try to do proactive cases where we go after drug organizations, and that's where we have focused investigations, FBI, DEA, Homeland Security, where we use all the tools at our disposal as far as surveillance, wiretap cases, things like that. But we're going after the drug organizations.
How serious is the heroin problem and the meth problem in New Mexico?
Very serious. And that's the reason that we are hoping to speak today to you, is you have various statistics out there, but they're all indicating that if we're not at the top, we're close to the top of heroin and opiate overdoses.
The opioid problem in the state of New Mexico is consistent with what we're hearing across the country. The CDC stated earlier this year that opioid-related deaths from painkiller medications are on the rise. And there's a new demographic group, a population of users and overdose deaths related to it. In terms of this pill mill issue of doctors overprescribing, what are you doing as a strategy to crack down on that? Because that's a contributing factor, is it?
Oh, absolutely. Yes. No, we also have a strategy. We're now looking at prescription drugs, and we're looking at pill mills or doctors who are prescribing pills for money without a proper diagnosis. We're also looking at people taking false prescriptions and getting prescription drugs, and we're also looking at people who are just stealing prescription drugs. So we're looking at those 3 areas. What the U.S. Attorney's Office is doing is taking cases that may not have taken before, but now we're taking it because this is such an epidemic in our society. So we're working with, for example, the DEA. They have a tactical diversion squad that is focused on this area, and we're working very closely with them.
Dr. Roth, the overdose deaths last year took a significant rise, 20%. In 2014, overdose-related deaths. What needs to be done right now in the coming months to address this epidemic?
Well, like so many things, there's not a single answer, and the first step is always to try to understand what's behind the rise in these drug-related overdoses. And when you take a careful look at the data, the prescription opiate deaths bounced back to where they were back in like 2008. But if you look at the other drugs, and that's not good because we had been seeing a pretty significant reduction in those types of drug-related deaths. But if you look at the other medications, other drugs like heroin, methamphetamines, the methamphetamine level since 2008 has gone up over 500%. And so the deaths related to that particular area and use of a drug is important to be aware of when trying to develop an intervention in an effort to stem that increase.
And so what have you concluded now in terms of a future in the prevention and the treatment?
Well, obviously, we drift into a joint program between the U.S. Attorney's Office and the UNM Health Sciences Center called HOPE, and that stands for the programs that we are focusing in around heroin and opiate prevention and education. And Damon has a number of programs that he's described out of his office. We have programs that focus around the education piece, and that relates to everything from having our faculty in the College of Pharmacy at the Health Sciences Center visiting middle schools and high schools, where they talk about what happens when you take a bunch of pills and you don't know what they might be.
But how is that different from other conventional programs that have been in existence for many, many years?
Well, many programs are in fact very effective. There's just too little of it. And over the last couple of years, we've been able to increase the focus. Unfortunately, because of a number of deaths that have occurred in New Mexico, there are programs where the Board of Pharmacy has required registries and ways to check the prescription habits of individuals. Those are new and, in fact, are just beginning to be implemented in an effective way.
Why is that an important component in terms of the federal level launching an initiative?
Well, what we're trying to do is we're trying to take a comprehensive look at this. And I think this is one of the first times where the law enforcement community is talking to the medical community, and we're trying to look at the entire spectrum and say, okay, these may be where the cracks are in the system, and how do we address these cracks? By doing this, by working together, for example, there's a number of things that we're working on this next year. We're currently working with OMI on an information sharing system. I'm confident that we'll be able to get there. By doing that, I think that will help us, law enforcement, be able to do our investigations better. I think you'll be able to give, for example, the medical school more timely, informed information. We're also doing things such as DEA. If I may give you a date on something, the DEA is doing a take-back in New Mexico on the 27th of September, which I think is really important because that's, with these prescription drugs out there, these prescription drugs are dangerous to folks. If, let's say a child or a grandchild takes someone's prescription drug, starts using it without it being prescribed to that person by the doctor, that's dangerous. So if we can take that extra medication off the shelves and give it to the DA would like to take back, that's important. We also have a speakers bureau that we're going to be putting together this fall, combined with law enforcement, the U.S. Attorney's Office, and the medical profession. We're going to be targeting the students.
What is the biggest, Dr. Roth, the biggest challenge right now facing field workers in terms of treatment, both the addiction problem and the overdose problem in New Mexico?
Well, you've heard about the Narcan program where we try to distribute that particular medication which reverses the effect of narcotics.
Yes, and last year we saw some impressive numbers. There were, I think, 900 cases of reversals.
Exactly.
Because of the Narcan administration.
Exactly. And so we would very much like to see that expanded.
Why is it good public policy?
Well, because of the lives that are being saved. I think any policy that is promulgated has to have an impact of benefit to the community, and clearly having Narcan available throughout the state of New Mexico has had its dramatic benefits.
How do you respond to the concern that the availability and administration of it might encourage heroin and other opioid-related use, knowing that your life can be saved?
It's hard for me to buy that argument. I doubt very much if people will deliberately go out and use heroin more preferentially, knowing that there's a reversing agent there. While I can't exclude that in being somebody's choice, that's a pretty hollow type of argument against the use of Narcan.
Mr. Martinez, in terms of your collaboration, not just with the University of New Mexico, but other agencies and organizations who deal with opioid-related problems, how do you respond to earlier this year in January, where the chairwoman of the Opioid Accountability Committee criticized the organization for a lack of coordination, working in isolation, and that it's a big problem here. How do you respond?
Well, the way I respond is the HOPE initiative is trying to coordinate. For example, one of the things that we're trying to do is not reinvent the wheel. Where we introduced the HOPE initiative was at the Bernalillo County Opioid Summit. And in working in conjunction with what they've already done, we're able to complement each other's efforts. One of the things that we have in this time and age is no one has all the resources, but by being able to pull together each other's agencies, we're able to capitalize off of each other's strengths, and that's what we're doing.
Finally, Dr. Roth, what will be a measure of success in 5 years from now?
Well, I think the answer is pretty obvious. We want to see the death rates relating to drug-related overdoses to dramatically go away. We don't want any deaths that are unintentional or could be prevented. So we would want to see a dramatic reduction in the numbers of deaths.
And how would you summarize a measure of success based on the HOPE initiative?
Well, with where we're focused, I think one of the obvious places we'll be looking for is if we're not one or two as far as drug overdoses in the future. The other place is by us going after those distributors, for example, with prescription drugs. This is a different type of drug distributor, not someone that we're used to. And we can see more diversion programs in the futures for these types of distributors. So we'll also be looking at how many people are we able to put into diversion programs.
Gentlemen, thank you. Appreciate your time
Thank you.
and discussion. It's an important topic here.
Thank you.
Thank you.